Hello everyone, let's try to solve this question together. So the blood culture reports are available for a preterm infant. The infant is on non-invasive positive pressure ventilation and receiving total parental nutrition via percutaneously inserted central catheter. She is also receiving intravenous vancomycin and cefepime. So look at the culture report. What do you guys think is the best action here? Okay, the correct response here is discontinue antibiotics. So few things to highlight. First, you see the blood culture. The report says that this is Staphylococcus hemolaticus. So as you guys remember that this is a contaminant. So and this culture was obtained on 6/10, and this culture was repeated next day, and the next day culture is no growth. So this is very reassuring. So stopping antibiotics is not a bad choice because the culture obtained initially was a contaminant. So that makes other options wrong. Why is that? Because there is no need to obtain blood culture from PICC line to diagnose Clabsi, although it's recommended that you have to obtain culture from central line and peripheral, but in neonates it's best to do a culture from the radial artery or venipuncture. If that is positive and that is a pathogenic organism and patient has a central line, then by definition it's Clabsi. So you don't have to use from the central catheter. Removing the PICC line at this point while the culture is already negative is no point, because PICC lines are difficult to obtain, and so it's not really easy to just take it out and put another one. So you don't have to do that. What about reporting to infection control? Do you guys think this is Clabsi? The answer is no, this is not Clabsi. It was just a contaminant, and which was finally the repeat culture was negative. So few teaching point that whenever you have a culture positive with a central catheter in, we always get worried about the Clabsi thing. So we'll need to talk about in the next slide how to differentiate from it Clabsi. Then overreaction is also not very, very important, and symptomatology is also you have to consider. So let's talk about that. So here we have see the differences between Staph api and Staph hemolaticus is like pointed out here, if you guys can see here. So basically both are commensals, and that was the case here, that it was commensal, as you see. So now what is do you think it's Clabsi? So what are the things needed to diagnose Clabsi? So this is another slide showing, or another insert showing, that the diagnostic criteria for Clabsi is that the patient has to have symptoms, the line has to be placed in place for 48 hours, the organism has to be a pathogen. If it's not a pathogen, you need pathogen means like not commensal, then you need, if it's commensal, you need 2 cultures. And of course you have to have no other sites of infection. If you have another source of infection, then of course it's not Clabsi. So again, this is a CDC, you can get to CDC, but the very easy way to remember the diagnostic criteria is by the acronym Clabsi. So to have Clabsi, for C is you have to have clinical signs and symptoms, L is line in placement, A is another source of infection. If you have another source of infection, that is not Clabsi. B is blood culture. Either you can have 1 or 2. Many centers do, in adults they do 2 cultures, one from the central line and one from the peripheral line, but in neonates you can do 1 culture. And again, depending upon the pathogen, if pathogen is commensal, you need two separate occasion. And of course sites, like we talk about, then in adults they use 2 sites, one from the central and one from, but in neonates you can do 1 is fine, and you look at the organism and decide, like we decided on the case. Now, what about the debate that Clabsi is in hospital? It could happen in outpatient scenario too. Like a patient is going home with the chronic need for medication or other therapy, and a central line is there and they get infected as an outpatient. That is an outpatient, is not nosocomial. But most of the time we face it with inpatient, and Clabsi is exclusively, I can say, is an inpatient problem. So anyway, again, to remind, Clabsi, remember Clabsi, to have a diagnosis, use the acronym Clabsi, and to make sure that these are the diagnostic criteria. And again, like in this case, we talk about that there is like 2 sites culture. In this case we decided there is no need for a PICC culture, there is no need to remove the PICC line because this first culture was a contaminant. There is no need to report to the infection control because this was a contaminant. Again, you can discontinue antibiotics because we follow antibiotic stewardship very aggressively, and we don't want to prolong antibiotic use in NICU, and especially in small premature babies. If you guys have time, this article is available online, so I will highly advise that you guys take a look at it. And this article really discusses the definition from different agencies, and also talk about the prevention plan. Very nice article, so do get some time to pull it. And again, this is freely available online. So I hope you guys have learned something together today. Please do like and subscribe to our channel, and you guys have a wonderful day. Bye.